Hannah Matthews is going to talk about policies and what government money there is behind the child care system, and she's going to tell us how well this is working. So Hannah, welcome.
How well this is working, or how well it's not working. That's right. So thanks very much, Chris. It's a pleasure to be here with you all and on this panel talking about this really important topic. As was just said, I am going to talk about kind of the overall context of funding for childcare through the Child Care and Development Block Grant, and a little bit more about how the system has fallen short during COVID. I want to start first by putting childcare in the context of an anti-poverty agenda. So really digging into the statistics that Linda gave you on childcare costs and what that looks like for low-income families. I think in the last 6 months, it's become clearer than ever that childcare is the ultimate essential industry. It helps parents to go to work, it helps children learn and grow, and it undergirds our entire economy. So as we're seeing parents with children, school-age children and younger home, there just simply isn't an economic recovery without childcare. And I think you're going to hear that loud and clear on this panel. For parents with low incomes, childcare plays an even more crucial role. When stable quality care is available to parents, to all parents, but in particular for low-income parents, we really see support to their employment and increased earnings. And conversely, when there are barriers to affordable, stable care, it can destabilize work and really impact earnings over time. Because our public investments in childcare are so woefully inadequate, as you're going to hear more about, childcare remains a very large expense for families, making it a huge impediment for millions of parents, and in particular, parents with low incomes. When parents can't afford stable quality care, but there are consequences then for both parents and children. Childcare is more than a work support. Care that is high quality supports children too. It supports their healthy development. For young children, it ensures their readiness for school. And we have research showing its impacts long into adulthood in terms of employment, increased earnings, and educational outcomes. As an anti-poverty program then, making childcare affordable for low-income families helps working parents today with their financial stability and supports children's lifelong earnings. So really an impact on both generations. And I just want to be clear also that we know that there are, we'll talk more about the real racial equity implications of our childcare system. It is children of color who are most likely to be in lower income households and have the least access to quality care. Now, as you heard from Linda, despite its importance, the reality is that for very few families, they're able to afford quality care. It's just simply out of reach. Most families struggle regardless of income. Next slide. And you can see on this slide that the struggle is particularly acute for poor and low-income families. The chart in front of you shows that for families whose income are below the federal poverty level, on average, those that pay for care are actually paying as much as 30% of their household income on care. That's nearly 3 times as much as higher income families who on average are paying about 8% of their household income. So a huge cost barrier there. Next slide, please. And the cost barriers to quality care are most acute for parents of color, with Black and Latinx parents having the least access to affordable quality care. There's a number of reasons for this. Care options are often limited in communities of color, and we know that Black and Latinx parents are disproportionately represented among workers in low-wage jobs with limited income, again, making childcare really a greater cost barrier. For low-income parents, assistance with paying for childcare can be an absolute lifeline. The Child Care and Development Block Grant is the primary source of federal funding for childcare assistance for low-income families. It provides a subsidy to pay for care so that they can go to school or go to work. It also funds much of the quality improvement dollars for the childcare system as a whole for all families. CCDBG is a block grant to states, meaning that states have a set amount of funding annually, regardless of need. So unlike other public benefit programs that we might talk about, such as nutrition assistance or health insurance coverage through Medicaid, all eligible families are not guaranteed access to this program. The program also gives states enormous flexibility in designing their childcare subsidy programs. So we really end up having about 50 different childcare programs state by state. The federal government sets broad parameters, so a floor for basic health and safety, and then states make policy decisions under that framework. States are deciding who can get served, what income level you can have to qualify, what rates are paid to providers, what share of cost parents have to pay, because this is a cost sharing model program, and also whether or not they have health and safety standards that go above that minimum floor. It is years of inadequate public investment that have led to a childcare system that is chronically underfunded, financially unstable, and in many ways simply fails children, parents, and providers. So despite the importance that we know and the research on how important these childcare subsidies are to low-income families, CCDBG right now is reaching only 1 in 6 children who are eligible for the program. Because of this underinvestment, states make those policy decisions in the context of scarcity. And that is what results in these enormous gaps that we see in our system. Very, very low rates paid to providers, cumbersome policies for families to be able to get help, waiting lists for childcare assistance, and most notably, really a shrinking system. If you go to the next slide, please, you can see here that while in 2019, federal funding for CCDBG was just over $8 billion. If you look before 2018, you can see that really for about a decade, CCDBG was near flat funded. There were very nominal increases in funding. In 2018, there was a bipartisan budget deal, which made a major investment in childcare. That was largely to pay for a reauthorization of the program that had occurred in 2014. So states needed those dollars very much to be able to make improvements to their program that Congress had put in place. But it simply wasn't enough to make up for the underinvestment of previous years. And we're still seeing that play out in states. Next slide. Maybe the greatest indicator of the weakness of the system right now is the declining number of children who are getting childcare assistance. So since 2006, 449,000 children have lost CCDBG funded childcare. And this is happening across the board because the investments just have not kept pace with the costs of care. And finally, if you go one more slide, CLASP has also done our own analysis to look at who is able to access help. Next slide, please. And we can see that among those families who are, among children who are eligible to get assistance, wide differences by race and ethnicity, and also by state. You can follow the link to the full analysis, which will have the state data. There are big differences in the share of eligible children who get access to subsidies. There's lots of reasons for this that we don't have time to go into on the call in terms of historic funding patterns, the state policy choices, the lack of outreach to communities. But I think it's important to keep in mind as we think about really scaling up and building a more robust system. So finally, how has the system fallen short during COVID? I think we are hearing that the pandemic hit an already very unstable childcare system and really exacerbated all the existing gaps that we already saw. With insufficient public investment, childcare programs were already operating on razor-thin margins before the pandemic. As Linda talked about, those childcare programs that were shuttered in many states in the spring found themselves without revenue continuing because childcare is primarily financed with parent fees. So when children stop attending care, providers are left with no resources. Congress included $3.5 billion in funding for childcare in the CARES Act, and those funds were critical to keep funds flowing to providers, to also cover the high costs of childcare for essential workers. Many states set up childcare for those workers that needed to continue going in with increased health and safety practices, which of course raised the operating costs. And this also allowed states to continue those subsidy payments to childcare providers and relieve parents of the cost burden. But unfortunately, that funding was completely inadequate and fell far short of meeting the need. It's now been more than 6 months since then, and childcare providers that are open continue to operate at reduced capacity to allow for social distancing, for smaller group sizes, increased health and safety practices. All that means that states have spent their CARES money and there is a need for a greater federal investment. Next slide, please. CLASP, along with the National Women's Law Center and labor economist Aaron Sojourner, estimated back in April, the monthly costs of covering the most urgent needs for childcare. And we calculated those costs to be about $9.6 billion a month. This would cover the full cost of emergency care for children of essential workers. It would sustain nearly 350,000 childcare programs, maintain jobs for 1.2 million childcare providers, and alleviate cost burden for families. Now, I will say that this analysis conducted in April, given the need for ongoing health and safety measures in childcare, this is likely an underestimate of the resource need now. So it's really important to understand, even as Linda showed how costly childcare, that childcare costs have gone up significantly and likely will remain elevated for quite some time. Short of this level of investment, we are looking at widespread permanent closures and the potential for enormous decreases in our country's childcare capacity. A June survey from the National Association for the Education of Young Children estimated that without additional federal funds, 2 out of 5 providers could close permanently. I think it's really important to note that these closures will likely be uneven. We started off by talking about the gaps in access to quality childcare for low-income families and in communities of color. We know that these are the communities that have been hardest hit by the public health crisis and the economic crisis. And you can add childcare as one more layer on that devastation that is very likely to be concentrated in those communities. So I'm sure that in the conversation, we'll talk more about public solutions. I just want to say in the short term, it's very clear that childcare needs dedicated public funding to keep childcare providers afloat and ensure childcare is available for parents that need it now and for parents that will need it in some time from now when it's safe to go back to work. I think in the longer term, it's really important that we begin reimagining what our childcare system looks like. You're going to hear us talk about it, treating childcare like a public good to make sure that there are investments at the level that's needed to ensure that quality childcare is accessible to all working parents, regardless of income. So I look forward to continuing that conversation in the Q&A, and we'll turn it over to Chris.
Go back about 4 slides. The breakdown by racial group. Unaffordable care indicator for working parents by race and ethnicity. Can you maybe just explain for me what these figures mean? So the total is, does that mean 63% of all parents cannot afford it and 72% of Hispanic parents cannot afford?
That's correct, right. So it's looking at the availability of childcare. I think this analysis really looks at licensed care availability in communities and what the costs are, and compares household income by race and ethnicity to what an affordable care would be. So again, thinking about the share of income that families are spending on care. The federal government has a benchmark that is widely used to say that parents really shouldn't be spending more than 7% of their household income on childcare, that anything more than that is unaffordable, which of course is the majority of families that pay for care right now in this country.
Right, and the source for these data, or the Census Bureau's current population survey, is these numbers, it looks like, are from 2017. Is that something that's asked on an ongoing basis? Is this accessible for kind of updating this analysis if it's something reporters wanted to do?
This is an analysis conducted by partners of ours at Diversity Data Kids. You can see the website there. And I would urge folks to actually look at their resources as well, because they have a number of briefs and publications on their website. So I'm not sure how frequently they're updating this particular data set. Okay,
well, all right, so thanks. So Tyler, if you could drop the PowerPoint. Just one more question for you, Hannah, before we move over to Catherine. This is kind of a big picture question on reporters who want to get access, or who want to cover the block grants on the state level. I mean, what are the metrics or the statistics they should be looking for in terms of affordability and access, and how easy is it to find, state by state numbers?
So you could go to any of the 3 organizations that are represented on this panel, and all of them have quite a bit of data on the child care subsidy program and by state. To give a couple of indicators. So as I said, the federal government sets these broad parameters and then states make decisions within that. So an example in terms of income eligibility, the federal government says that families can qualify for child care assistance if their income is below 85% of the state median income. In reality, there are 1 or 2 states that meet that threshold. In the vast majority of states, the average income of families getting help is below 150% of the federal poverty line. So states set that income eligibility anywhere below that level. And in fact, most families are much less well off that are getting that help. Similarly, it's a requirement that parents do have to work to gain access to the child care subsidy program. But what that definition of work is varies tremendously by state, how many hours are required, whether or not a parent can also go to school or has to be working at the same time. So there are indicators about parent co-payments, again, the rates to providers, the income eligibility, all of those are really important to get a sense of the reach of the program and also how much access a parent has to the range of care available, because that is essentially one of the challenges of our program, is that with rates being held so low, then often parents actually can't access some of the higher quality care available in their community.